Hi, I'm Karen from Birth and Baby Village in Noosa. I'm passionate about helping you have a comfortable pregnancy, a really straightforward birth, and a super smooth start to life with your new baby. I'm sure you've heard of women having their baby stay in the breech position and needing to have a cesarean, or other mothers who had a long tiring backache labour and needed to have an epidural. Perhaps you've heard of women whose babies got stuck and needed forceps or vacuum or even an episiotomy, and other women who went way past their due date and had to have an induction because their babies didn't engage well in the pelvis. Maybe even one of these situations has happened to you. Well, often these situations arise because of the position of the baby in pregnancy and during the labour and birth. My intention with this session is to explain to you how these things can happen and how you can create balance and space in your body so that you can have a smooth and straightforward labour and birth. We're seeing more and more women have these kinds of complications in labour and birth due to the position of their babies during pregnancy and during labour. So why? Well, here are some factors. First of all, labour and birth work very well. It's a beautiful design and it's worked right down through the ages. If it didn't work well, we wouldn't be here. But for some reason, we're seeing more and more complicated labours due to the position of the baby. Why is that? Well, labour and birth work very well, and if you know about the amazing design of the uterine muscles, the shape of the woman's pelvis to guide the baby toward the exit, the birthing hormones, and of course the innate intelligence of mother and baby, you'll know it's a beautiful design. But if our bodies are the same as women right down through the ages, same bodies as your grandmother and her grandmother, what's different? It's not that our bodies have changed, it's that we use them differently. So first of all, most of us don't do hard physical work like our grandmothers had to. Even my mum used to, when she was a young wife, she had an old washing machine, and so she'd wash them, the clothes would wash in there, then she'd have to drag them out, rinse them all by hand, and then put them through an old wringer. I and all of us have the luxury of modern conveniences. So when I want to do the washing, I pop the clothes in, I go ping, and I go and have a cup of tea, and the clothes get washed. So even when my mum was pregnant with my sister, she was down on the floor scrubbing the kitchen floor so that it was clean for when she came home from hospital. Well, I certainly don't have to work hard like that, and possibly you don't work your body that hard either. We spend a whole lot of time sitting down. Just take a moment to stop and think, how much time do you spend sitting during the day? At your computer, in the car, at work, watching Netflix at night? I know we all do it, but the hours probably add up and we do a whole lot more sitting than our bodies are actually meant to do. We might go to the gym or do Pilates or an exercise class once or twice a week and work really intensely for an hour, but then we tend to go back to our regular postures and our routine movements, and often we don't stand or sit in a very good postural way. Most of us wear heels at some time or another, and that takes our pelvis out of alignment. Some women have done lots of gymnastics or dancing over the years, or they've done a whole lot of Pilates or exercise where they've drawn their tummies in because we just want to have nice, tight, flat tummies because that's the fashion. And these women are often really tight through their pelvis and their pelvic floor. And many women think that they have to keep squeezing their pelvic floors and doing a whole lot of pelvic floor exercises, or keep holding their tummies and their pelvic floors tight. Another factor, as kids, we run around a whole lot, but as we get older, we don't run around so much, and we're much more static than we used to be, and we're not as flexible as we used to be. And many women are having their babies later in life. So by this time, we're usually quite unbalanced and favour one side over the other, maybe crossing our legs, carrying a toddler or heavy bags on one side, or working the same way, like dentists and hairdressers who are reaching around their clients, reaching around one way very much a lot of the time. Or we just spend a whole lot of time sitting on computers or checking our phones. All of this means that our bodies are out of balance. Why does it matter if your body's balanced? Well, let's have a look. If a pelvis is nice and balanced, if it just sits in its normal natural position where it's meant to be, the muscles that hold it in place, like the tummy muscles, the butt muscles, the back muscles, and even the pelvic floor muscles, they're nice and balanced also. So they're not too loose or weak, and they're not too tight. Then the uterus is able to sit well in the pelvis in a nice balanced position. And so then the ligaments that hold the uterus in place are nice and balanced as well. So when the uterus is nice and balanced, the baby can find a good position in the uterus. So around about 32 to 34 weeks of pregnancy, the baby's brain has a big growth spurt, and that makes the brain and the head much bigger. And because it's the heaviest part of the baby, gravity draws it down towards the mother's pelvis, and then the baby's facing head down. Then the baby can nestle onto onto its side in the mum's body. So usually most babies settle on the left side of mum's tummy. So mums, just stroke the left side of your belly and imagine that's where the back of your baby is. When the baby sits into the side of the uterus there, its little back curves and it encourages its head to tuck in. So then that makes it easy for the baby's head to enter the pelvis sideways. And then the chin tucks in so that the smallest part of the baby's head is coming through the pelvis, and the head's pressing against the cervix so that the mother has nice, efficient contractions. Then the baby can travel the shortest way through the birth canal. And when the pelvic floor muscles are nice and toned and stretchy, they can stretch open over the baby's head. And it's quite a straightforward and simple labour, the way labour is designed to be. However, most of us are unbalanced. So many of us tend to have a pelvis which is a little bit tilted. So maybe one side is higher than the other, or maybe it's twisted so that one side's forward, the other side's back. Some of us have a tail that tucks under, so we have quite a flat back and tight butt muscles, or some people tilt their pelvis the other way, so they have a really big arch in their lower back. If a woman's ever fallen over or had some sort of a jarring accident, it's likely to have affected the muscles and the ligaments all around the uterus and the pelvis. And this means that the woman ends up with some ligaments and muscles that are loose and others that are tight, and they're pulling one side out of balance. So just take a moment now to stop and think where you might have little niggles and aches and pains during your pregnancy. Many women complain of pain in their lower back, or even down lower around where my thumb and little finger are. And that's where you have these two joints here, the sacroiliac joints, where the sacrum meets the hip bones. And often the mum has niggles in one side or the other here. The mother might have a sore back. She might have aching hips and it's hard for her to sleep at night. Perhaps you have pain here in your pubic joint or shooting pain down your legs. And it's very common for women to feel like there's a lot of discomfort up here in the ribs. So it feels like they can't take a breath and that the baby's up there pressing under their ribs. So all of those things indicate that there's probably some tension and some tight and unbalanced muscles within the pelvis. And so with an unbalanced pelvis, this is what can happen. A baby might stay breech, it might stay facing up because it can't turn down, because often the ligaments that hold the uterus in place are really, really tight, or they're pulling the uterus across to one side and there's literally just not room for the baby to turn head down. Or the baby might turn head down, but instead of coming in on the side and being able to enter the mother's pelvis really well, the baby might be trying to get into the pelvis facing toward the front. And so the mother might not go into labour. And what the medical maternity system does is give the mother, break her waters and give her a drip and try and shove the baby in to the pelvis. The baby might make its way into the pelvis facing toward the front, but then its hard skull presses against all the nerves in the sacrum and the mother's spine, and that can cause really bad backache during labour. Contractions can still keep happening as the baby's turning and trying to find its way into the pelvis, but often that results in a really long, tiring backache labour. Often women then have an epidural, but if the baby can turn all the way around and click, it finds its way into the pelvis, then labour can proceed well. Sometimes what happens is the mother doesn't even go into labour and goes way past her due date because that baby can't make its way into the pelvis. With tension in the pelvis, with the muscles and ligaments on the outside and even within the pelvis, it's harder for the joints to stretch apart the way they're designed to. So the great part about the design of birth is that the baby's head has soft bones that overlap to make the baby's head smaller, and the mother has these beautiful joints here, these big joints, which are designed to stretch open and allow the sacrum to move out of the way to make a whole lot more space for the baby. And even the tailbone has a little joint to move out of the way. And with a tight pelvic floor, the mother has to work hard to push her baby out. And sometimes mothers have an unbalanced pelvic floor, especially if they spent lots of time crossing their legs. So one side can be tight and the other weak, which means that when the baby's trying to come through the pelvic floor to be born, the baby's head is actually tilted across to one side, and then it can get a little bit stuck or make that more painful or take longer. So what can you do to, number one, bring balance to your pelvis and your whole body and all the muscles and ligaments, and to make as much space for your baby as possible? Well, there are very simple things you can do starting right now. So can you just freeze right now? Don't move, and just notice how you're sitting. Are your legs crossed? Are you sitting on one sit bone than the other? Have you slouched back in your chair? Are you sitting on your sacrum and your tailbone, which then jams up the sacrum and can give you an aching back during pregnancy, but also jam up those muscles and ligaments so that you can't create that more space during your labour? So right now, uncross your legs if they were crossed and sit on your hands. And as you just rock from side to side, you're going to feel that you're sitting on these bones. They're called ischial tuberosities, but let's call them sit bones. That's what they're known as, because we're meant to sit on them. So we're meant to sit on these sit bones here, but most of the time we tend to slouch back and we sit on our sacrum and our tailbone. So now uncross your legs and put your feet flat on the floor. If you've got a cushion, pop the cushion behind your back, push your bottom way back so that your back's supported, feet flat on the floor, and open up your shoulders and your chest. So now you've created a whole lot more space for your baby and your breath. You can relax your shoulders, your neck and your head. Your main muscle of breathing is your diaphragm, which is here. And so now your diaphragm can move to breathe properly. Just slouch a little bit and feel how your diaphragm gets squashed. So open it up again just by leaning back and just resting nice and supported against the cushion. And when your diaphragm can move, that's at the top of your core muscles, your pelvic floor muscles are at the bottom and they can move as well. So now you're toning your pelvic floor muscles and making them nice and balanced with every breath you take. The heaviest part of your baby is its head with its skull bones and its brain. So the back of the baby's head's the heaviest part, and gravity's just going to draw the heaviest part down toward the ground. A whole lot of women spend time leaning back with their tail tucked under and slouching because it feels temporarily comfortable. And what that does is it encourages the heavy part of the baby to be sinking down and pressing against their spine, which eventually gives you a sore back during pregnancy. But it also then encourages all the muscles to support the baby's position of coming in facing the front rather than facing the side and being able to turn toward the back. First of all, try to avoid sitting back on your tailbone and your sacrum, slouching so you can't breathe properly and you're squashing your baby, and uncross your legs. Certainly don't sit with your laptop computer anywhere near your baby. Find other ways to sit or lie, lying on your side, or sitting upright, or leaning forward, or sitting on a gym ball. If you've got to carry little ones, maybe swap sides or see if someone else can hold them for you. And take care if your handbag is super heavy. Maybe take some things out of it so it's lighter. Great things you can do are sit well, as we've already discussed, or do less sitting. For working, make sure your computer's at the right height, or even stand up for some time, or sit on a gym ball where you can move your pelvis. In the car, the bucket seats ensure that your pelvis tilts back and give you an aching back. So sit on a folded towel to flatten it out a little bit, lift you up, and pop a pillow in the small of your lower back. After you've taken a drive, certainly have a stretch, particularly after a long drive. And every day, if you can, get out and go for a walk and move that pelvis all around the place to help get your baby into a great position. Sit on a gym ball, move your pelvis in circles, tilt it forward and back, side to side, and find ways to lie on your side. And lean forward to create that beautiful hammock for your baby, or sit up on a folded towel or a blanket to lift your pelvis up, open your diaphragm, and breathe. Don't jackknife. A jackknife is when you're lying on your back and then you sit straight up, or if you're sitting up and you lie right back again. It puts too much strain on your pelvic floor, on your tummy and your back. Always roll to your side first before getting up and lying down. Learn how to brace your core muscles when you do anything that creates pressure in your abdomen, anything that makes you go, ugh, like standing up, sitting down, or lifting anything. I'd love to encourage you to join a pregnancy yoga or a pregnancy Pilates class. Make sure that it's got lots of breathing, and after you tighten, that you relax as well. More walking, because it's so fabulous, swimming, dancing, and learning how to breathe and soften. So all of these things you can do on your own in your own time, but I really encourage you, if you can, make an investment to see a body worker, a physio, osteo, a chiro, a pregnancy massage therapist, or even acupuncture can help to diagnose and assess and help you with bringing balance into your body. And it is essential to learn how to do your pelvic floor exercises correctly. Now, most of us don't know how to do pelvic floor exercises correctly, and most of us have some imbalance in our pelvic floor. Many women actually have a pelvic floor which is too tight or overactive, so it's more important that they breathe and learn how to relax their pelvic floor than to tighten it. The best thing you can do, and I encourage all of my mums to do it, is to see an expert in this area who is a women's health physiotherapist, to see her around 20 weeks of pregnancy for assessment, treatment, and learn how to breathe and do pelvic floor exercises right for you. I then encourage them to see the physio again at 34 weeks to learn how to do perineal massage, which will help to prepare your body for stretching during birth to prevent tearing. I've gained most of my knowledge on this subject from spinning babies and optimal maternal positioning. If you go to their websites, you're going to find fabulous videos to show you how to do these specific movements to help to create balance and space in your body, and find a whole lot of really valuable information. And I really love the Body Ready method by Lindsay McCoy, and her little video clips on Instagram are absolutely fabulous. So go take a look. So a little while ago, I wrote and self-published a book. And in my book, I devote an entire chapter to why does baby's position matter? Because this information is so important. In here, I've talked to you about all of the things that I've discussed during this session, and I've got lots of exercises or just stretches and gentle movements that women can do, that you can do during your pregnancy to lengthen out those muscles and bring balance to your body. My book also contains 35 birth stories from women who have taken my advice and done a lot of these things to create balance in their bodies, and their stories are a living testament to the fact that they worked really well because they had great births. Thanks for bearing with me. I trust that you now understand the mechanics of your body, where complications can arise due to the position of your baby, and the many things that you can do during your pregnancy all the way through. Just simple things, maybe some simple changes, just being really kind to yourself. You're never going to achieve complete balance, but just each little part that you do, each little action you do is going to make a little difference, and those little things can add up so that you can have a comfortable pregnancy without backaches, and sleeping so that you can sleep well, a really smooth, straightforward labour and birth, you may even love it, and a smooth adjustment to mothering your baby, so you're not having to recover from a long and tiring labour. Thanks for being here. I wish you well with your baby's birth.